Then also one of the initiatives that I spearheaded was Hope for Healing. There are so many great resources out there, and they shouldn't be in a siloed approach. They shouldn't have the nonprofits over here and the private sector here and the government here. Hope for Healing really is, and it's really from the brainchild of the governor saying, I don't want you guys to work in silos. And I said, okay, great. How can we collaborate more to make sure that we're maximizing the resources, and we also have accountability for outcomes? And one of the ways that we've done that, one of the many ways, is Hope for Healing, and that website is really an aggregator for first responders and others and students and teachers to be able to find the resources that they might need to help make a difference. So today we are very excited that we have money going towards first responders specifically for their resiliency and their mental health. And so the total of $12 million is going to be put forth through the Department of Children and Families, and it's going to go to the 6 DCF regions. And then from there, you'll be able to apply, and it'll be able to filter down locally, because we know what works in some areas might not work in another area, so localizing it. And again, the most important part of this is that you have the peer component. So just like we have at the Crisis Network, where you have a peer-to-peer with the veterans, it's so important, and I think Dustin can talk to this, if you don't have those lived experiences being out in the field and seeing one of those 180 traumas that a lot of you guys endure over the course of your careers, if you don't have the perspective, then it's hard to really break through. So we hope that this $12 million is going to be able to be used in a great way to be able to provide opportunities that might not have been there before.